morning, everyone, and Happy New Year. This is Bill Miles with the Hilton Head Island Bluffton Chamber of Commerce, and welcome to our first Tele-Town Hall of 2021. We're glad to have you back with us this year. You know, I was out this morning early and heard the birds starting to sing, starting to chirp a little bit, and I know that we're only 66 days away from spring, and I'm looking forward to that. And as forward as I'm looking to spring, I'm also looking forward to the RBC Heritage. And we know that that's only 92 days away. And I see Steve Wilmot on the call. Steve, thanks for joining us today. We'll look forward to hearing from you in a couple weeks for an update on RBC. We're glad to have each of you with us today. We've got a stellar lineup of speakers, lots of information coming in this next 55 minutes or so. You know, we're glad to be back with each of you and here to deliver relevant and unfiltered updates on our region. And we're going to hear everything today from vaccine schedules to new expansion projects, redevelopment opportunities, and then also from our local hospital CEO. And so I'm pleased to kick off the call today with one of our elected officials and who's really been on the forefront of action throughout the past year on the pandemic front. And whether it's been the rapid expansion of testing opportunities that happened in 2020 or his current efforts to expedite the vaccine rollout, Senator Tom Davis isn't afraid to roll up his sleeves, as we all know, and certainly bring ideas and solutions to the table. So with us this morning, Senator Davis, we appreciate you joining us. I believe you're in Columbia, and look forward to hearing an update from you on the vaccine effort and from a state and regional perspective. So welcome, Tom. Okay, we're having a little trouble there. I guess Tom is still trying to join us and to dial in. And while we're waiting for him, we're going to switch gears and we're going to move from vaccines to really redevelopment and capital investment. And we know that, Tom, is that you? Okay, so we know that redevelopment is very, very important to the region, and we're lucky to have partners locally with the Riverstone Group and the Sea Pines Resort. And here to talk about a new exciting project that they have is the president of the Sea Pines Resort, that's Steve Birdwell, and also he'll be joined by the director of Resort Development, Cliff McMacken. Steve, we know you're no stranger to the callers, and we appreciate you being with us, and tell us a little bit about what's going to be new in Sea Pines.
Well, thank you, Bill, and good morning, and thank you for including us in today's agenda. We're very excited to talk about two topics. We're going to talk, of course, about the quarterdeck, and also want to take a minute to mention our Savor Sea Pines, which has a month-long culinary festival we have coming up in February. But the quarterdeck, very excited here to move forward with the new quarterdeck. You know, the tradition in Harbor Town has been the quarterdeck for more than 50 years. And people remember the early days when the bar was upstairs and David Wingo was on the keyboards. And then we moved into the bar, got repositioned downstairs, and we had decades where the Simpson brothers were the featured entertainers, and every night was a party at the quarterdeck. Recently, we've been focusing on fresh seafood and sunsets over the Calabogie Sound. So we've studied the various options for the future. We've looked at could we renovate the building? There's many issues with the current building, and we've decided and excited to move forward with an all-new, brand-new, top-to-bottom quarterdeck. We're working with the international design firm based in New York, Hart Howerton. Many people will remember them, that they have a lot of experience in the Low Country here. They've done most of the design recently at Palmetto Bluff. So we're working with their team. The features of the new quarterdeck will be a great new restaurant and bar, outdoor spaces on the first floor. And then we're really excited with the rooftop bar that's going to go up on the second level. And also we're going to be including a casual coastal market for grab and go and casual dining experiences. But I'm going to let Cliff take it over and talk more detail with the plans and show you some additional images.
All right, thank you, Steve. We're excited to really show you a window into the next generation of the quarterdeck, but also the next generation of Harbor Town, which this will be the catalyst of. We've reoriented the building. Virtually sits on the same footprint as the original building. It's not much larger, the footprint wise, but the second floor will have a more expanded space. One of the big changes is we've reoriented the building. So the current building is sort of positioned in a diagonal position on the site. And so what we've done is we've rotated it so that the views are perfectly aligned with the three primary views. So we've got the harbor, the 18th green of Harbor Town Golf Links, and then of course the beautiful sunsets of the Calabogie Sound. So what you're seeing here is an image. It's a conceptual image. We're working with the Sea Pines ARB currently, and we'll be furthering that design. Let's see, I'm having trouble flipping to the next slide. Okay, in this next slide, the focus of the design has really been sort of an indoor-outdoor approach. So this is a view as you're approaching the front door of the restaurant, looking back towards the 18th green, and you can see that with operable partitions on the outside, that it's going to have a real easy flow from the interior dining to the exterior dining. Steve had mentioned that there's a casual market element. This is positioned on what's the parking lot side now, and what this location will also be highlighted by a boardwalk. The boardwalk is going to extend from the current Harbor Town Pier over to the main Marina Walk. So really improving air circulation and the flow of people as they move around Harbor Town. Oops, skipped one. And then, the one we're most excited about is the second floor. It's a rooftop bar. The concept is oyster bar. And we're going to outfit this floor with 300 degrees of operable partitions. So you've got crosswinds blowing through at certain times. And a real rooftop feel. Obviously, this image highlights the sunsets over the Calabogie Sound. So we're excited about setting the stage for the next generation, and along this restaurant, along with the lighthouse, it's going to be a must-see destination and a real highlight to the Harbor Town experience.
Well, just a little bit about the timing. Our architects and engineers are working feverishly to finish up the final design plans. We've got permitting underway, and we've got several agencies that have to weigh in on that. Our hope is to be in a position to start the demo in late February, next month, and then we'd like to start the new construction of the quarterdeck in late March of this year, and then be in a position to reopen the new quarterdeck next spring prior to the spring season. It represents a $13 million investment from Riverstone Group, and we're really excited to move forward. It's going to be the future of Harbor Town, and really looking forward to this exciting project. So should I stop there?
Yes, thank you, and Cliff. Certainly exciting plans. Thank you for the investment of the Riverstone Group, and please thank them. Also, a question I actually, when you were talking about David Wingo and the Simpson brothers and the quarterdeck, certainly brought back some flashback memories for me as well. Those were great days, and I know that great days are ahead. We have a question, and the question is about Savor Sea Pines, and where could they go to find additional information for that?
Well, thank you for bringing that up. Our culinary team has designed and created a month-long celebration of socially distanced events that are going to be running throughout the month of February. And all events are socially distanced, completely safe. There'll be somewhat limited capacity on each of them. It begins with the reopening of links at the Harbortown Clubhouse at the beginning of February. We've got dinners, oyster roast, wine events, whiskey dinner. We've got incredible guest chefs that are coming in to join us. We're going to have a farewell party for the quarterdeck in mid-February and many other events. And everyone can go to savorseapines.com to access the list of events and to make reservations. Hopefully people will come out and join us for all these great events that we're going to be running during February.
Kelly has just posted that website on the in the chat box, so certainly go and check that out. Steve, that's a stellar lineup, and congratulations to you and your team for being able to put that together. Another question, first question here on the quarterdeck, coming from Jamie, and Jamie is asking what the outside seating capacity that you anticipate that being.
It's for the total seating capacity is going to be around 500 seats. And we've got about 300 of those are going to be outside, split between 2 levels.
Great, thank you. And Tim is asking once again about the when you're thinking the completion date will be.
Expecting that it's going to be completed by the end of February of 22 in time for the spring season.
That's terrific. Guys, that's got the questions answered today. Thank you for sharing those plans. Also, as a reminder, Savor Sea Pines, check out the website, and it's going to be a great month of February. Steve and Cliff, thanks for joining us this morning.
Thank you.
All right, exciting news from Sea Pines, and redevelopment is always wonderful to hear about. Our Senator Tom Davis is back with us now. I think he is connected and coming to us. And Senator Davis, thanks for joining us. Looking forward to hearing more on the vaccines.
Great. Thanks for having me, Bill. Can you hear me okay?
Sure do. Good morning.
Good morning. All right, let's start with who's eligible to make appointments to receive the vaccine. As of midnight last night, everyone or residents who are 70 years or older can register to receive the vaccine, and they can do so in a couple of different ways. Both Butte Memorial Hospital and Hilton Head Regional will take information from residents, help them complete the VAMS registration form and schedule a vaccination appointment. I've posted on my Facebook page and other social media platforms how you can contact Beaufort Memorial or Hilton Head Regional to make those appointments. Beaufort Memorial, the vaccination sites will be at their hospital in Beaufort and also at their Okeechobee facility. Hilton Head Regional at the Hilton Head Hospital, and also the Coastal Carolina Hospital in the Bluffton area. Another way that residents 70 years and older can make appointments is to go to the DHEC online mapping site, which is scdhec.gov/vax, VAX locator. And that will indicate the points throughout the state that have vaccines. Those points will be denoted in green. Other authorized points that currently don't have vaccines are denoted in red, but in real time, that's updated. So what residents can do if they want, they can go online at that DHEC site and then click on a green dot, and that provides you with the contact information for the provider. And you then have to contact that provider directly. And again, as I indicated earlier with Hilton Head Regional and Beaufort Memorial, they'll take your information, register you under the VAMS program, and schedule an appointment. Now that's the mechanics of going about scheduling a vaccine. And in terms of supply, supply is ramping up. We've currently received about 250,000 doses of the vaccine, and about 70% of those doses have been administered. Increasingly now we're seeing Moderna vaccination doses being provided. And that's significant because the Moderna vaccine doesn't require the super cold storage that the Pfizer vaccine requires. And what that means, Bill, is that as the doses ramp up, additional distribution administration points can be authorized, retail pharmacies, individual doctors. So it's really a logistics exercise right now. trying to maximize the supply, getting that supply down to a number of providers, and then making the access for residents to schedule those appointments as seamless and as efficient as possible. In terms of when additional populations will open up, it'll likely go to 65 and older sometime in the next week or two. And again, that's a function of supply. And the way the supply is being administered throughout the country is on a population basis. I mean, it's strictly on South Carolina's population as a numerator, the population of the United States as a denominator, and that's the percentage of available doses that will come down to South Carolina. And then in South Carolina, again, it gets distributed to those various location points that are on the DHEC map, and then they schedule the appointments with individuals. So I realize there's a lot of frustration out there right now. I think things are going to get a lot better, once the supply increases, and manufacturing of the doses are ramping up rapidly. So, but that's the status right now, Bill. And the number one priority is making sure we get our fair share of the doses, making sure those doses get pushed downward to the location points, and getting out to residents the means by which they can contact those location points and schedule vaccination appointments.
Thank you for that update, Senator. A couple of questions for you. The first one's coming from Judy, and Judy is saying that we live in Hilton Head part-time and have been here since October 1st. Are we eligible to get the vaccine in South Carolina?
Yes. And another point I would make too is you're not constrained to the locations in Beaufort County. You can go to any one of the locations throughout the state that is denoted in green on the DHEC map and contact them and make an appointment. So there's no preference being given to individuals who are more proximate to a certain location. Again, as I indicated before, Bill, the red dots and the green dots indicate whether or not one of those providers has the vaccine and is currently scheduling appointments. That's updated in real time. So if you're unsuccessful in establishing or getting an appointment, keep refreshing and check periodically, because what's red will be green and what's green will turn red, and that'll be a dynamic process going forward.
Thank you, Senator. Next question is from Jill, and Jill is asking, she's saying our 55 plus community is over 25 years old. Transporting our aging population to their medical appointments will be a huge burden on our short-staffed volunteers. Are there plans for offering vaccinations to Sun City?
Yeah, I mean, in terms of the rollout, they're starting first with, again, in Beaufort County, the hospitals and certain designated doctor's care offices. It'll then broaden out to pharmacies, individual doctors, and then further on, there'll be actual testing events, sort of like we did last summer and fall, where we stood up COVID-19 testing events and individuals could come to the site. Mass vaccination events like that are also in the distribution rollout plan. And again, that will be a function of how quickly supply ramps up of the doses. But the answer to that question is yes, there will be these locations stood up. So there'll be the opportunity to go to these events. And as you say, in communities like Sun City, I can envision maybe setting something up at the pavilion or something, some other centrally located place where logistics, you can get a lot of people in and out.
Next question is coming from Kimberly, and she's asking, where do you see essential workers such as a food pantry and critical service providers who haven't closed during the pandemic, providing critical service to the communities following the vaccine rollout?
Yeah, currently, I haven't seen any movement in terms of redefining the 1A, 1B, 1C categories. 1A being the frontline workers, and then 1B and 1C in descending order of what's deemed to be priorities. I don't know the answer to that question. I don't sense that there's any movement to change the definition of those categories. I think it's much more likely that we see, as supply ramps up, the age threshold dropping down, and that's where you're going to capture most people is through that age classification dropping down.
Thank you, Senator. Another question from Rob. Rob is asking if there's any discussions for Memorial Stadium in Clemson or Williams-Brice Stadium in Columbia to be locations to provide the vaccine.
Yes, I mean, it's understood by DHEC and by Governor McMaster that we're in a race. It's important that we get inoculations done quickly. And so this initial rollout is a function of a limited supply. As supply increases, not only will you see more providers, as I've indicated, pharmacies, doctors, but also large testing events in stadiums, parking lots, things of that nature. So the answer to that question is yes, that's in the rollout plan. Again, dependent upon supply. And as supply ramps up, then the ability to have a much more broad distribution will be permitted.
One last question for you, Senator, and that's coming from Susan. And Susan is asking, when will teachers be vaccinated?
Yeah, I think that's a good question. We talked about that yesterday in Senate Medical Affairs Committee and trying to bring, I think there's roughly 100,000 teachers throughout South Carolina and giving them priority. And I think that's an excellent idea. I mean, these teachers are trying as hard as they can to reach students virtually. But anybody, and I've got a student, my daughter Claire, who goes to Beaufort High, is virtual learning. There's just no substitute for that in-person teaching experience. And so getting teachers back in the classroom in a way, in a context in which they feel safe, I think that ought to be absolutely a priority. And there's going to be a push, I suspect, to put teachers in terms of priority of getting a vaccine.
Senator, thanks so much for joining us. Appreciate the input and also really appreciate the leadership you've provided in rolling out the vaccines and the testing, et cetera.
Yeah, just urge patience to everyone. We're ramping up supply. We're going to expand distribution points. We're going to work out the kinks in terms of registering for appointments. All this is happening in real time, but it's the number one priority. In fact, it's the only priority I have today is making sure all that happens.
Thank you. Thank you very much, Senator. We'll see you soon.
Okay, Bill, take care.
All right. That was Senator Tom Davis updating us on the vaccines, and as he's in his office there, and we appreciate the great work that he's doing on behalf of that. Yesterday, the U.S. Chamber of Commerce CEO Tom Donahue rolled out the State of American Business, and in that plan, he outlined the path for a widespread economic recovery through a bold agenda. We know that the U.S. Chamber is involved in so many initiatives, and we're especially appreciative of Tom Sullivan. And Tom's been a speaker with us many, many times during the previous year, and we're glad that he's back with us today. And one thing I just want to mention to you about Tom and his what he brings to the game. You might not know that he served under President George W. Bush as the highest ranking government official charged with advocating for small business in Congress. And Tom, as we've told you before, we're thankful each and every day that you're advocating for small business on behalf of the U.S. Chamber of Commerce and all of our members. Welcome back. Glad to have you.
Bill, thank you. Thank you for having me, and really right back at you. I'm extremely grateful to have you and really to possess the technology to clone you, Bill, into 1,600 other Bill Mileses who run local, state, and regional chambers across the country, because collectively we certainly are a force to reckon with. You were nice enough to ask if I could give an update on federal aid for small business, and the collective power of your chamber combined with 1,600 to 2,000 other chambers of commerce really played out in the last several months. Kind of good news, bad news. The good news is that on December 27th, a stimulus package that contained over $284.5 billion in aid to small business, became law, the Economic Aid Act. The bad news is it took way too long for that to happen. So we learned a great deal from that advocacy effort, but bottom line is we're grateful for you and for your membership in pushing Congress to take action, and finally, albeit a little too late, did take action. So let me give you a quick summary of what that Economic Aid Act contains, really emphasizing on what's going on right now, because I know a lot of your members are concerned with that, not necessarily what's going to happen 3, 5, 7 weeks from now. What's going on right now is the PPP loan program is up and running exclusively for community financial institutions. Those are CFIs, because we've kidded in the past that really to be legitimate in Washington, D.C., you have to have an acronym. So CFIs include a group of community development financial institutions, CDFIs, minority depository institutions, certified development companies, CDCs, and microloan intermediaries. These are mission-based lenders that generally work with entrepreneurs in small businesses and others in economically disadvantaged areas. Part of the Economic Aid Act, consistent with the Trump administration's SBA, was to target in on small businesses that needed help the most. And there are a lot of data out there that show that minority-owned businesses have been harder hit by the pandemic than others. So there is a prioritization for that community. I do want to make sure, as a very, very important footnote here, is that there is enough money for all the small businesses who will be eligible for a first PPP or a PPP, what's called second draw, which is part of the Economic Aid Act. Now, Bill, as you know, many local chambers of commerce and other nonprofits are formed as what are called 501c6 organizations. And finally, we got Congress to acknowledge that you need help too. And so 501c6s will be eligible for PPP loans. And I've got to be very clear about this because there's been some confusion. They are almost exactly the same terms as the PPP that we talked about in April, May, June, July, all the way through August 8th. There's no diminished revenue requirements and stuff like that that have to do with another part of the Economic Aid Act. It is if you are able to certify that you need that money in order to operate due to economic harm caused by COVID-19 pandemic, the 501c6 is able and eligible to apply and receive a PPP loan. Now, there are some limiting criteria. 300 employees or less, not $1 million can't be spent on lobbying. But aside from that, 501c6s, and I think the largest components to that are associations, local, state, regional chambers of commerce, and destination marketing organizations, which, not surprisingly, also have an acronym, DMOs. And many chambers of commerce operate both as a chamber of commerce and a DMO. And so folks like you, Bill, who is a seasoned association executive, know exactly what I'm talking about. Now, after the PPP loan prioritization for CFIs, it will open up to more lenders. Now, we don't know the exact date for that happening. We know that that will not happen before Friday. So right now, the PPP loan portal, they call it the portal. It's basically a lending window where a lender gets an electronic message back from SBA upon application saying, we have reviewed the application and here is a loan number. That portal has been open to CFIs starting on Monday. Starting today, it is open for CFIs to get second draw loans. That second draw, there are some qualifications here. That second draw does limit the maximum loan amount to $2 million. It has a similar calculation as the first PPP loans. You take your average employee salaries per month, multiply it by 2.5, and that's your loan. If you're in the hospitality or restaurant sector, then you multiply it by 3.5, and that's your maximum loan. Now, in order to get a PPP second draw, which simply means that this is the second PPP you will have received, you have to have exhausted your first PPP loan. And Bill, quite frankly, there's no way in heck someone who needs a second PPP has not exhausted the first loan. So we'll just kind of put that aside for a moment. You also do have to show that your revenues are 25% or more less than a similar quarter in the prior year. Now, if the PPP loan is less than $150,000, you don't have to provide that documentation up front, but eventually you're going to have to show it to the bank in order to get forgiveness. Above $150,000, you'll have to have some type of records, whether or not it's an annual tax return, or if you actually keep records and books that show quarter by quarter revenues and losses. And again, it's a 25% or more reduction of revenue quarter 2020 compared to quarter 2019. So the lenders that are beyond CFIs, so those are the national banks with local branches, those are community banks, credit unions, and others. They are anxious to start opening up their applications and putting in applications on behalf of small businesses. I do know, Bill, that there are some banks who are already accepting applications so that they're working with small businesses, knowing that when SBA does open the portal to them, they'll be able to efficiently process these applications and get the loan number back to the borrowers, and most importantly, get the money into the borrower's accounts. So again, I'm told by my colleagues at SBA to urge patience. There are a few things that are a little bit different this time around, just from an administrative perspective. First of all, the calculation for how much money is available, and that's that over $284 billion. They ran the numbers on the absolute maximum number possible for loans, and it is below that number. And so the reason I mention that is to try to urge patients that there isn't necessarily a rush to the banks as there was in early April and in early May. The second, from a patient's perspective, is it's going to take a little bit longer. When the bank hits the send button on the application, SBA, prompted by their inspector general, has a more robust verification process than it did in April and May. So it's going to take 1 to 2 days for the SBA to get back to the bank to say the identity of the borrower has been verified or authenticated, and here is the loan number. So again, a little bit more of a targeted approach this time around, first with CFIs and then the rest of the lending community. And second, a little bit more of a authentication verification process, because anyone who's seen some of the headlines on PPP over the last 7 months or so knows that they took a pretty big hit on kind of being perhaps a little lax on oversight controls in the first round. And quite frankly, Bill, I don't blame them. Their first mission was to get cash onto Main Street. And I've heard it explained or described as messy. In fact, one banker told me it was like a dog's breakfast. I have a little dog, and I've seen him eat every morning, and I think that's actually a pretty accurate description. But the whole push was to get cash out to the business community. They did that. They're trying to do it in a slightly more judicious way than it was done in April and May. And judicious translates into a little bit more time on the back end. One last thing. As you know, Bill, I'm pretty passionate about this stuff, so it's easy to get me kind of worked up and go on and on and on. But there is one last thing that I want to make sure to highlight. And then I will guide you to a online guide that actually explains this stuff a lot better than I'm doing right now. But this one piece that I really, really want to highlight is what's called the Employee Retention Tax Credit. I know. Anytime you say tax, half of the people's eyes glaze over, and the other half of the people think, oh, well, it's tax. I don't have to worry about it until like February or March when I start, getting my documents together or talking with my CPA or updating my QuickBooks software. This is different. The Employee Retention Tax Credit, which can offer up to $14,000 per employee for 2 quarters is a tax credit that is taken out of employee withholding taxes. So Social Security, Medicare, stuff like that, the employer portion of the payroll taxes. So Bill, this is cash that comes back into the business that otherwise would go to IRS as soon as you do payroll. So it's immediate cash. And that's why I want to emphasize this. The Economic Aid Act made the employee retention tax credit a lot more attractive than it was in April and in May from the CARES Act. And so rather than me confusing myself and confusing all of you about what the parameters of the employee retention tax credit are, please talk with your bookkeeper. If you have a payroll processor, talk with a payroll processor, or talk with your accountant and say, hey, some guy from Washington, D.C. told me about the employee retention tax credit, and it's a really big deal, and it could free up some cash. Can you explain to me how I can take advantage of it? Those are critically important conversations to happen now. Please do not wait until February or March, because this is cash that could be freed up to be invested into your business right now. So Bill, with that, I'll stop. I know Kelly is going to post our small business aid guide that is available online. Bill, I think you might have been the one to tell me that our publication of guides is our R&D effort, rip off and duplicate. So this guide, you want to slap your logo on it, you want to push it out, say it's your own, you could take credit for writing it. We don't care. All we care about is that the small business and the small business community, who are all of you, have the information and so that you can tell your friends, neighbors, and small businesses that there is help. And here is some advice on how to access that help. Bill, I'm happy to take any questions, and really thank you from the bottom of my heart for inviting me to talk with your group this morning.
Thank you so much, Tom. A couple questions for you here. The first one is from Bethany, and Bethany is asking, is there a benefit in using the same institution for the second draw for PPP?
So Bill, the answer to Bethany is yes. And the advantage of working with a lender who knows you, there's a couple of reasons. One, because when a lender knows you, it actually gets into some technical aspects. Lenders now aren't able just to say, oh, that sounds like a good business plan, let's give a loan. They actually have to do a lot of due diligence to verify exactly who you are, and then communicate that information to regulators in Washington, D.C. to give assurance that this isn't some money laundering operation by a terrorist organization. I mean, it sounds a little bit far-fetched, but the amount of due diligence that lenders have to do to tell the feds that they're lending to legitimate small business it's a hassle, a big time. And so when you have a prior existing relationship with a lender, it makes it easier for them to lend to you again and again and again. And quite frankly, small businesses are a tremendous customer base for banks. And so this isn't simply for the good of mankind and Main Street in America. It's good business practice for businesses to really open their arms up and welcome in repeat small business customers. Because quite frankly, in this Economic Aid Act, the federal government is taking the risk off of the bank loans. And the banks and the lenders, many of whom are senior officials at chambers of commerce all across the country, they are the heroes here. They are getting the money into these small business bank accounts. And so I don't know, Bill, I'm trying to come up with an initiative of have you hugged your lender today, but I think we've got to get everybody vaccinated first.
That's a good plan. 2 more questions for you, Tom, then we'll let you run. The next one's from Alan, and Alan's asking, can you use the PPP program and the employee tax credit program at the same time?
Alan, I love that question. The answer is yes. And you couldn't use the employee retention tax credit when these programs were first, it was an either or when these programs were first rolled out in April. So yes, you can have a PPP loan. You can get a second draw PPP loan and take advantage of the employee retention tax credit. So thank you so much for asking that question, because it is an unqualified yes, you can.
All right, thank you. The next question is coming from Carolyn, and Carolyn is asking on the employee retention tax credit, can those funds be used for wages as well, or should I go for the PPP to help offset wages?
Oh, wow. Now we're getting really into the nitty gritty. Simple answer is you cannot use the funds for the exact same thing. So you do actually, you have to be pretty, anal about, where you're directing your money from the PPP loan and where you're directing that money from the employee retention tax credit. So, one of the benefits of working with entrepreneurs and small business owners is you all will find a way. But really good question, and be really precise on making sure that these streams of federal aid are spent for different things.
Tom, it's always great to have you. Thanks for all you do. Keep up the great work, and thanks for always bringing a wealth of knowledge when you come on.
Well, thank you, Bill. Thank you for the partnership. We love working with you, and you're making all the difference. So thank you.
We'll see you soon. That was Tom Sullivan with the U.S. Chamber of Commerce. We're going to transition now to really what was I think was probably the busiest state agency last year, and certainly in 2021, it's starting out that way as well, and that's undoubtedly DHEC. We're going to talk a little bit with the DHEC epidemiologist, Dr. Jane Kelly, and she's back with us to share some information on the vaccine. And Dr. Kelly, I know we have several questions for you as well that are already have been posted. So welcome.
Thanks. I'm just unmuting and hope to share my screen. Am I unmuted?
You are. Good morning.
Okay. All right. Good morning. Thank you. Hang on just a second. I've got a lot of files open. And I hope to address some of the questions that came up during Senator Davis's presentation as well. Let's start with the numbers. This is nationwide, more than, and this is already dated, right? This is from yesterday, but we are now at more than 23 million cases of COVID-19. And maybe more pertinent to this discussion is what's going on in South Carolina. And again, this is already out of date. We've had many days where there were more than 4,000 new cases in a single day. So the projection continues to be up. So focus down on more specific regional numbers. As I mentioned, the number, these are the, when we were having weekly calls, I was presenting updates on what has happened over the past week. It's been a month since we've had a call. So these are the number of new cases and deaths since December of 2020. So in the United States overall, we've had an additional, in 1 month, 11.5 million new additional cases, 132,000 plus additional deaths. In South Carolina, it's a parallel situation. And over the past month, we've had over 172,000 new cases identified and almost 2,000 new deaths. In Beaufort County specifically, there have been in the past month over 4,000 new cases, over 30 new deaths. And these are only the confirmed cases and confirmed deaths. So this might be a little bit different than if you look it up, for example, on the New York Times tracker. CDC has been doing modeling projections, both for the nation as a whole and for individual states. I don't know the details on how they are doing these modeling projections, but I thought I would share it anyway. That in South Carolina, based on what they have been seeing over the previous 4 weeks, they are projecting for the next 4 weeks a continued increase in the number of cases and a continued increase in the number of deaths. All right, let's talk about some of the positive aspects. And one of the positive aspects is that, yes, vaccine is here. South Carolina started receiving our first allocations of vaccine December 14th. And so I want to review a little bit about who is included in the different phases and how many people there are in those different phases. We are currently in phase 1A. Phase 1A was originally defined as workers in healthcare settings. And I phrase it that way deliberately. This is not just healthcare workers like doctors and nurses. This is workers in healthcare settings who are at increased risk of exposure to SARS-CoV-2. And these would include janitorial services, that would include X-ray techs. It would include the people cleaning the rooms after patients have been discharged from the intensive care unit. It would also include ambulatory care workers such as EMS or staff working in private doctor's offices, urgent care, including some fire and public safety individuals who are also involved in medical response. So not all fire personnel, but the ones that might be involved in airway protection or performing CPR, for example. Phase 1A also includes long-term care facility residents and staff. So that's skilled nursing home, assisted living, and in some facilities where they have 3 tiers, where they also have independent living. This varies from facility to facility. It depends upon the relationship that they set up in the beginning to have those in independent living vaccinated as well. These two groups together were estimated to be about 350,000 persons. Now that the governor has added age 70 plus, it adds approximately another 200,000 people. There are more than a great many more than 200,000 people age 70 and above in South Carolina, but some of those are already covered in the long-term care facilities, and some of them are covered even in the workers in healthcare settings. South Carolina currently receives about 30,000 doses of Pfizer and 30,000 doses of Moderna vaccine each week. So we get each week 60,000 doses of vaccine. And that's always subject to change. If there is some glitch in manufacturing, if they have trouble with quality control at the manufacturer's site, we may receive lesser allocation. That's what we anticipate through the end of January, receiving 60,000 doses per week. Hopefully, as manufacturing ramps up, we will get additional doses of those vaccines. Currently, Moderna is going to all long-term care facilities. Once that is covered, we will be able to move the Moderna vaccine to other people in phase 1A. And as we begin to transition into later phases, we'll be able to use both of those vaccines. There are other vaccines in the pipeline. AstraZeneca, Johnson & Johnson, Novavax, those are all in phase 3 studies right now. When those reach authorization, emergency use authorization, as we anticipate they will, then those would be additionally available to us. But right now, we are really crunched. There are just really limited doses of vaccine. This is a very limited resource right now. So as you had heard from the senator, that currently DHEC has an online map. The email location is there, southcarolinadhec.gov Vax Locator, and it shows the locations currently accepting appointments for those age 70 and older to receive vaccine. They color code them. So if there are openings, it's a green dot. If there are no current available openings, you get a red dot, and that map is mostly red. Because as you saw the numbers, we have extremely limited dose amounts of vaccine. Most of that is currently going to workers in healthcare settings. But there is an evidence-based reason for opening it up to 70 plus, and that is the highest mortality group is by age. More than 2/3 of the people who have died in South Carolina from COVID-19 were age 70 and above. Again, a lot of those were people in long-term care facilities who have many other medical problems. Age by itself, it lowers immunity. It does lower your ability to fight infection, but most of those deaths were among people who had other medical problems as well. Nevertheless, it's opened up to age 70 and above, but I know if you click on that right now, you may find that there might be in your region 0 appointments open right now. This is going to change on a day-by-day basis. I mentioned we have currently we have received in South Carolina over 233,000 doses of vaccine, but we'll receive more tomorrow. Hopefully it will be that 30,000, a total of 60,000 between Moderna and Pfizer. But that is a moving target. We don't find out until the day before we receive the vaccine what our allocation will be. So this is a challenge. Let's talk a little bit about phase 1B, because I think this is a very sticky one to understand. Phase 1B includes ancillary workers in healthcare settings who weren't vaccinated in 1A. For example, clergy who visit patients in the hospital. It also includes persons living and working in congregate settings. So for example, those working in homeless shelters or working in corrections, because we have had substantial outbreaks associated with both of those facilities. They're unavoidably overcrowded, if one person who is asymptomatic or pre-symptomatic and brings virus into that setting, it spreads quickly. This next group I'm going to discuss is the one that I think is engendering the most confusion. This is frontline essential services workers who are at unavoidable, substantially increased risk for exposure to SARS-CoV-2, the virus that causes COVID-19. That is that their occupational risk is higher than that of the general population. This is an advisory committee on immunization practices recommendation that DHEC has embraced. Not all workers in essential services, as defined by the Department of Homeland Security, Cybersecurity and Infrastructure Security Agency, are in phase 1B. Yes, they provide essential services, but remember that definition was established in case there were terrorism events, in case there was war, in case there is a natural disaster. It is not appropriate to include all workers in essential services in the midst of a pandemic access to this scarce resource. We need to make sure that we are doing this to protect those who are most at risk of severe disease and death. So vaccinating to just pull an example out of my hat, the 30-year-old healthy truck driver who is not at increased risk of exposure to people with SARS-CoV-2. Yes, he or she provides an essential service, but in terms of distribution of this scarce resource, not all workers in essential services fall in 1B. Now that doesn't mean they don't get vaccine. They get vaccine in 1C. It has to be phased allocation because we have such a limited resource. Teachers, school staff, and daycare personnel are in 1B. They are unavoidably exposed to children, to adolescents. And we know epidemiologically that they have been substantially at increased risk for exposure to SARS-CoV-2. We have that data. We have had school-related outbreaks. I didn't finish that estimated bullet point because I was looking for the numbers to try and estimate how many people fall in this category. And I'm sorry that I don't have that number, but I'm sure you can imagine 1B is a really big group. I'd like to move to talk a little bit about new variants. We can come back to questions about the phases if desired. So there are new variants that are circulating, but before we talk about them, I want to remind people that viruses, and especially RNA viruses, which is what the SARS-CoV-2 is, they frequently mutate. Not all mutations are important. There are lots of mutations that don't mean anything at all, that don't even change the amino acid, don't even change the proteins. However, the variant that began to circulate in England, in the UK, and starting in September, it has now spread to account for about 60% of recent infections in London. And the modelers looking at this epidemiologically think that it may be more transmissible. They estimate that it's about 56% more transmissible, more contagious. That variant has been identified in the US. It's not because people went to England and brought it back that we know of. It's not travel associated. By that, I mean some of the people who are infected didn't leave the country. So they must have gotten it by person-to-person transmission from somebody else who did leave the country. The good news is that there's no evidence that this variant causes increased severity. We're not seeing an increased number of people hospitalized or an increased number of people deceased because of this variant. There is another variant found in South Africa. It was identified in October. It shares some of the same mutations as the one from England. It must be because that's just a common spot to mutate. Some parts of the gene are more likely to mutate than others. Both the England and South African variants have been associated with a higher viral load, meaning that more viral particles are found in the nose when they do a nasal swab, and that's why we think they're more contagious. This is where we have found these cases in the United States. So right next door in Georgia, we have not found any of those variants in South Carolina as yet, but we expect that this variant will spread. As I said, we're not completely sure what the importance of this is. It's not causing worse disease. It might be more contagious, but we don't know that really 100% either. It may be, is it biology or is it people's behavior? Did it increase so much in London over the holidays because it was the holidays and people were gathering together indoors, saying, oh, it's just one day, I'm not going to worry about it. We don't know that, but the suspicion is that it spreads more easily. Here's what we don't know. As I said, whether that increased spread is biology or behavior or a little bit both. We don't know how widely it has spread in the United States. We do monitor this in South Carolina. The way we do that is when people get a nasal swab and they have their PCR test, we also take that virus and do genetic sequencing. Not on everyone, they do it as a random testing. They do that sequencing to look specifically for this variant and for others. Other things we don't know are, could this variant have a different response to medications and to the monoclonal antibodies? We don't know yet. And we don't know 100% whether whether the manufacturers need to tweak their vaccine to accommodate this new variant. We think the current vaccines should still work. And let me try and explain this from a biological point of view. When you have vaccine-induced immunity, or if you had the disease and now you have immunity, that's immunity to several different places on that spike protein. So if you have one mutation in one little place, it shouldn't affect how well the vaccine can affect you, because it should protect you in other places. I mean, to put numbers on it, that spike protein that the vaccine is made to is about 3,000 nucleotides. That's like letters in describing the spike protein. The mutation is in fewer than 20 of those nucleotides. So yeah, the mutation is important. It might lead to increased contagion, but we have good evidence that vaccine will still be effective. Pfizer has been doing studies. Moderna has done some studies, but they haven't published them yet. But we do expect that the vaccine will be effective against these new variants. So we're still advocating strongly, more strongly than ever, around these same mitigation measures. You guys can all recite these by heart. I'm going to focus on the two bolded at the bottom about testing frequently and isn't there anything else that we can do. I do want to remind people that there are two basic categories of tests that are available, and we are recommending people get frequent tests. If you've been traveling, if you think you might have been exposed, certainly if you have any symptoms, or you just want to get random testing so that you know about keeping yourself and your family safe. We highly recommend frequent testing. One word of warning: the rapid tests are great because they give you an answer right away. They are not as accurate. So if you get a rapid test and it is positive, you can hang your hat on that. It probably really is positive. If it is negative and you think if you have symptoms and you think you really were exposed, go get the PCR test. The PCR test is 98 to 99% accurate. And it's not just a nasal swab. They've also got a saliva and an oral swab that you can do for a PCR test. But the rapid test in this particular study, in people who had symptoms, that rapid test missed 1 in 5. And in people who had no symptoms, who were just getting it as like a screening test, who were positive with the nasal swab test, the rapid test missed 3 out of 5. So rapid tests are great. They give you a fast answer. But if you really want to know, and you have a negative test, you need to get the better test. What else can you do while you're waiting for COVID vaccine? Well, I recently read this article about pneumococcal vaccine. That's the Pneumovax is one of the names. There are a couple of different pneumococcal pneumonia vaccines, that there's cross-reactivity between the pneumococcal vaccine may give you some protection against COVID-19. This is not just a non-specific thing. They tested it in a bunch of other vaccines that I've got written there on this slide, and that didn't seem to increase one's resistance. So I just want to repeat these recommendations that there are a lot of people eligible for Pneumovax. It's part of the routine pediatric immunizations. So if you have kids or grandkids, or you know other people with children, you know, I know this has been a tough year for keeping up with vaccinations, but you know, the pneumococcal vaccine is recommended as a series for all infants, 2, 4, 6 months, and then a booster at 12 to 15. If the child has missed those, even if they missed them years ago, they can get catch-up vaccinations. So if there's a child who's 12 years old who didn't complete that series of 4 doses, you know, check with the pediatrician. If you didn't complete, it's not too late to update that Pneumovax. That will help to protect against COVID-19 as well. There are a bunch of other individuals who are eligible for Pneumovax. If you're age 65 and above, you can get, it's a little bit, it's not Pneumovax, it's a different one, but it's a pneumonia vaccine. Also, anybody age 18 to 64 who has other medical conditions. And I didn't give a complete list here. There is a list on the CDC website, but it covers a lot of people: diabetes, chronic heart, liver, lung disease, current smoker, people with heavy alcohol use. They're all eligible for the Pneumovax, and that'll help to protect them during the pandemic from COVID-19. And to put in a plug once again for influenza vaccine, not just to protect you from the flu. This study showed that there was a lower incidence, lower number of cases, lower number of COVID-19 deaths among people who were also vaccinated against influenza. So if you haven't gotten your flu shot, get your flu shot. All right, one more time in the never-ending series of masks. Do masks really work? I want to point out that there are masks and then there are masks. You know, I know CDC recently has said you can use a neck gaiter as a mask. I just want to emphasize that that really is inadequate. You don't want a single layer of cloth. It's not, and it's not just a physical barrier. It's also an electrostatic barrier. So the best masks have at least 2 layers and of different materials. So I walked through that pretty quickly. I'm happy to take some questions.
All right, Dr. Kelly, that was a lot to catch up on and a great update. Thank you. The first question is coming from Glenn, and Glenn is asking, is the 65 or older age based on actual birthday or birth year? And
currently in South Carolina, we are going by the 70 and older. I'm aware of HHS recommending 65 and older, and that is currently being discussed. But right now we are at 70 or older. But in answer to your question, for all of these age groupings, we are going by date of birth, not year.
Okay, thank you. Next question is coming from Rebecca, and Rebecca is asking, will the availability of the vaccine to high-risk individuals like my son, who is disabled and prone to respiratory illnesses, be an option before releasing it to the general public?
Yes. So I'm sorry, I didn't talk about phase 1C. Phase 1C includes people of any age 16 and above, because remember the vaccines are only approved down to age 16. Any individual 16 and above who has a host of medical conditions, which will also include various disabilities, developmental, intellectual, physical disabilities. So that's when your son would be vaccinated.
All right. Next question from Allison, and Allison is asking, what phase does type 1 diabetic fall into?
Very good question. Both type 1 and type 2 would be in phase 1C. And this is part of why we feel urgent about making it clear that essential workers does not include everybody in essential services. That would be millions and millions of people. And to be equitable, who is at greatest risk of severe disease and dying? It is people who are at risk because of increased age, but also because of medical conditions. So certainly we want to vaccinate those essential workers who are exposed and have increased risk in their occupation, but that's just not true for everybody. We want to make sure that we can get vaccine as soon as possible to the most vulnerable.
We'll do one more question on phases before we transition to another question. And in the meantime, Kelly has posted or posting the list that you can pull up on the website and check out what illness you might have and what phase you would be in. But this is a question from Kay, and Kay is saying, I have rheumatoid arthritis. What phase does that fall into?
Same thing, 1C, because rheumatoid arthritis is an autoimmune condition.
Okay, thank you for that. Next question is from Lily. Are food rescue volunteers eligible? I heard Meals on Wheels volunteers are able to make appointments.
So this depends upon whether you are front facing the general public. So individuals who are involved in food service, working in a food bank, or other food workers who are face to face with people, knowing that, for example, grocery store checkout clerks, you're face to face with the public. You have some uncontrolled exposure because some people refuse to wear masks or refuse to stay socially distant. So those individuals would be included in phase 1B. I phrase it so carefully because people who are working in the back office, who are not dealing, on the front line with the public, they would not be in 1B. It has to do with whether you are face to face with the general public.
Okay. Next question is coming from Carla. And Carla is asking, what is the accuracy rate for rapid tests?
It depends upon the person doing the test also. So there's operator error. But in general, what we know with rapid tests is that they are, in general, 80% sensitive, so 80% accurate. However, if you have no symptoms, if you're asymptomatic, it may be because you're very early in your infection, and the rapid test won't pick it up if you're very early in infection. And that's when accuracy goes down.
All right. Charlene is asking if flu rates down due to the precautions we're taking for COVID.
I think so. Flu rates are definitely down. We're probably at a fifth the flu rates that we would usually see this time of year, both in terms of number of cases and deaths. So that is really good news. And I'm sure wearing a mask, keeping your distance, all those things are playing a role.
All right, Dr. Kelly, and one last question here. And that last question is, can the virus be spread by those who are vaccinated?
Can the virus be spread by those who are vaccinated is a really important, subtle question. So you get vaccinated, and we know from the studies, from the vaccine company studies, we know that the vaccine prevents 95% of symptomatic illness. What we don't know, and though they're doing these studies now, we don't know whether it prevents asymptomatic illness. So it is possible. And this is why we ask people who, even after they've been vaccinated, to wear a mask, because you might be vaccinated and you don't get sick, but you might still get infected, as in that you still have the virus in your upper respiratory system temporarily. It doesn't make you sick, but you might be able to transmit it to others. And that's why we're cautioning, wear a mask, maintain your distance, even after you've been vaccinated, until we get enough people vaccinated in this country that we reach herd immunity.
Dr. Kelly, as always, you're a wealth of information. Thank you so much for joining us again today, and we'll look forward to having you back on our next call.
All right, thank you so much.
Thank you. That was Dr. Jane Kelly with DHEC. Our final speaker today, we're going to drill down a little closer to home, and we're fortunate to hear from Jeremy Clark, who's the market CEO for Hilton Head Regional Healthcare. Jeremy, Happy New Year, and we're happy to have you joining us this morning again.
Happy New Year to you, Bill. I'm glad to be here this morning. Appreciate you having me back in these in very challenging, but also very exciting times as well. And I'll just reiterate your comments on Dr. Kelly. She is a great resource, and I know personally I've passed her name along to other people in our community to speak to, because she does such a great job. Well, I'll start off. I'll tell you a little bit about what's going on in our two hospitals, and then we'll shift our focus to vaccines. So right now at Hilton Head Hospital and at Coastal Carolina Hospital, we have a total of 23 COVID positive patients in our two hospitals, with 3 of those individuals being in the ICU. That's certainly a higher number than it was about a month ago or so, the last time I was on this call. But it's in line with what we're seeing in our community. It's in line with what we're seeing across our country right now. It's still lower than what we saw back in mid-July. And so I feel like our teams are managing it very well. They're very experienced in this now and are managing this well. We still have beds available, both our medical beds and our critical care beds as well. So overall, I think we're managing that. I usually talk about preventing COVID during this time, but given the news and the excitement this week, I'm going to shift my talk to talking about vaccines and vaccinations. So for as challenging of a situation as COVID is, the promise of the vaccines has been incredibly exciting. So we started vaccinating our employees and physicians on December 16th with the first dose of the vaccine. Every single colleague and physician on our staff that wanted the vaccine got the vaccine. And I think it's important to note that last week, these individuals received the second dose of the vaccine. So it's really great to see that progress. After that group, we expanded to local EMS partners, local volunteers in medicine, volunteers, and other Phase 1A healthcare workers in our community. And these Phase 1A individuals are now scheduled through the end of this month and into February. Overall, this part of the process has gone very smoothly. We have not had any issues with vaccine supply. We are very appreciative of DHEC being so responsive and helping us get the vaccine that we need to get to our community. So very appreciative of them and their work on that. This week, as everyone knows, we received the exciting news from Governor McMaster that we would be allowed to vaccinate individuals age 70 and over. This is great news. We are honored to do it. And as you can imagine, we've received incredible interest and really incredible demand about this service over the last 2 or 3 days. So I'll start off just talking a little bit about how to do it here locally. You can go to our website. It's hiltonheadregional.com. I've been told the best browser to use is the Google Chrome browser. We've done it on others, but we've seen the Google Chrome browser being the best to use on that. There's an orange link, an orange banner at the top of the page, and in it there's a link that says vaccine information. If you click on this link, a form will pop up for you to fill out. We're going to ask you for your name, your email address, a couple of other data points, and you'll hit submit. That starts the process. Within 24 to 48 hours after that, the individual will receive an email from the CDC, not from the hospitals, but from the CDC to the email address that they submitted. That email will have a link, and that you will go through that link to complete the registration and to schedule your appointment. We absolutely understand that as volume on the CDC website grows and volume on our website grows, there may be some technical issues. We are aware of that. We know that we have our IT team standing by to troubleshoot a lot of that. And to reiterate something Senator Davis said earlier, we really are asking everyone to please be patient. We will get to everyone as expeditiously and as safely as possible, but we are seeing incredible interest. Just to put it in perspective, our site actually went live about 7 o'clock last night, and in about the 12 hours since then, we've had over 10,000 people go online, fill out the form, and submit it. So there is incredible interest that is out there in the community, and we are working hard to accommodate this. We have been trying to get the word out just in the past few hours this morning, and over the last couple of days, we've been taking requests on a dedicated phone and dedicated email line. We're now in the process of sending the web link to those that emailed us. We'll be calling back those who called. We also proactively emailed over 15,000 individuals who we had interactions with before, notifying them about the service. And we had a press release that went out this morning with that information as well. So we are trying to get the word out, but most importantly, what are we doing to expedite the process? And so right now our appointments are full into February. So we're going to be looking at our ability to add additional appointments, not only in February, but some in January as well, to try to accommodate the demand of these new groups. We're also already working with our state and local partners to determine if the mass vaccination events, which Senator Davis referenced earlier, how we can best do those at multiple locations throughout our community. So we're actively working on that. We were very successful with the mass testing events in the summer. And so we know that we can pull off the logistics and the manpower when we have the support of this community, which we have since the beginning. So very excited about those possibilities. And then just continually refining our processes to get better and more efficient. And that may include in the future changing locations or expanding hours to be more efficient and to serve more of the community. So I'll just remind everyone, these processes are new to the CDC, they're new to DHEC, and they are new to us as well. And please, just asking everyone to be understanding, to be patient. We're all going to continue to get better and continue to vaccinate everyone. As Senator Davis said earlier, the more, as we go along through this, more supply of vaccine is going to come online, and more distribution sites of the vaccine, pharmacies, physicians' office, things like that, will come online as well. That's going to help. Meet the demand that we're seeing. So, Bill, I'll pass it back to you for some questions. But just to wrap up, I always like to remind everyone our hospitals remain ready to handle these COVID patients, but also non-COVID patients. We really appreciate the leadership of our state and local officials in helping us through this. We appreciate everyone's support for our caregivers. And I want to remind everyone to wear a mask, keep your distance, and wash your hands. And now I can excitedly say, when it's your turn, sign up for your vaccine. So, Bill, I'll toss it back to you for any questions.
Okay, thank you, Jeremy. First question is coming from Joe. And Joe says, I filled out a form on December 8th and recently received an email to fill out the form again. Do I need to do this? And what is the best contact number for the hospital to speak with someone?
Okay. If you fill out a form on December 8th and you got it again, I would ask you to please complete it again. You can call on our website. There is a dedicated COVID line that you can call. We are in the process of standing up a call center to help handle that call volume. But they should be able to help you walk through the process and find out where you are in the system.
Next question comes from Arthur, and Arthur's asking, with so many people vaccinated at Hilton Head Regional Hospital, how do you maintain socially distance while waiting in line for the vaccinations?
Great question, Arthur. So we are spacing people out while they're waiting in line. And then just as importantly, in the recovery period, so we'll watch you for 15 minutes after the vaccination. We are recovering everyone in a large room where they are spaced out and socially distanced. Everyone is also wearing a mask and doing the procedures like that as well to make sure that we stay safe.
All right. The next question comes from Brennan, and Brennan is asking, once you get your first shot, is the date scheduled for you to receive your second one?
So great question. When you get your first shot, we are encouraging you that day to make your second appointment for 21 days later. It is recommended that you use the same location as you got your first shot in, but we are trying to work with the people that we're vaccinating right now to have them make the appointment while they're actually in the recovery phase, that 15-minute recovery phase, so that they leave here with the second appointment already booked.
Okay, thank you. Next question is from Katie. And Katie is asking, do you anticipate partnering with local pharmacies to vaccinate residents?
We would love to. We would love to see local pharmacies be able to receive the vaccine on their own and start that process. We know that there's a lot of interest locally from pharmacies and from physician offices to get their patients, their populations vaccinated. We're very supportive of that. Right now, I believe it's more of a supply issue that's holding us back there. So yes, but we'd love to partner with pharmacies to get that done.
All right. Jeffrey is inquiring why the 15-minute recovery phase.
Well, in a very, very small group of individuals, there is some initial reaction to the shot. I believe the numbers I've seen are in between 5 and 6 for every million shots that are given. So we have trained healthcare providers keeping an eye over those people, keeping an eye on them, just making sure that everyone is safe and gets through the vaccine. But again, just to reiterate, it is a very, very small percentage of individuals.
All right. Last comment, not a question, but a comment is coming from Rick. And Rick is asking, they're saying to please thank you and your entire team for the terrific job that you're doing there at Hilton Head Hospital.
Great. Thank you, Rick. We are very fortunate to have an awesome group of caregivers and all employees here. It's a great physician, great medical staff as well. So thank you for your comments.
Jeremy, as always, a very informative update. And thank you so much for that. And we'll be in touch and look forward to having you back on to further update the community in a few weeks.
Great. Thank you, Bill. I appreciate it. Happy New Year to you.
All right. Happy New Year. That was Jeremy Clark, the market CEO for Hilton Head Healthcare. That's going to conclude our call today. One last thing I want to mention for those of you local government happenings. Last night, the town of Bluffton named Scott Marshall the interim town manager for the town of Bluffton. And so Scott certainly brings a great knowledge and experience to that job, and we'll look forward to working with him in that capacity. As we close today, as always, I want to remind you to please be kind, stay safe, and wear your mask. And we'll look forward to talking to you real soon. Have a great rest of your day, everyone. Thank you.